Hi, my name's Hayden.Vaughn, and today we're going to be giving our patient the drug Furosemide, and the trade name for that is Lasix. Its classification is a diuretic, and it's used to treat fluid retention and swelling. The mechanism of action for this drug is it works by blocking the absorption of sodium, chloride, and water from the filtered fluid in the kidney tubules, which then causes an increase in the output of urine, or commonly called diuresis. Its route of administration is PO, and it's usually used in patients with CHF, liver disease, or kidney disease. Some of the contraindications for this drug are low magnesium, calcium, sodium, and potassium levels in the blood. And those are kind of the same lab values you want to be checking before you give the patient this drug. Some special considerations for the nurse to think about when she's giving this is you always want to assess the fluid status of the patient, which involves their intake and output. It's usually given in patients, as I said before, with edema related to heart failure to try and kind of treat that fluid retention in those kind of patients. Some of the side effects are obviously urinating more than usual, headaches, confusion, or dizziness. Some of the incompatibilities for this drug would be patients that have pre-existing health conditions such as diabetes, cirrhosis, renal dysfunction, ototoxicity, things like that. So now we're going to be giving our patient the drug, and the first thing we're going to do is check our two patient identifiers, which is name and date of birth. So can you give me your name and date of birth?
Michelle Vaughn. My date of birth is 4/10/69.
All right, the next thing we're going to do is take the drug that we've pulled out of the Pyxis already and took to the patient's room, and we're just going to confirm all that information. So we're going to confirm it's the right medication, the right dose, the right time, and the right route that the medication should be given at. So we're going to scan our patient's wristband to confirm that that's her real name and date of birth, and that this matches with the one in our computer system. Next, we're going to scan our medication to see if it correlates with the medications that the doctor has ordered that are in the computer system already. So we're going to take our Lasix package that we pulled out, we're going to scan it with our barcode scanner, and we're going to see that it says Lasix 20 milligrams to be given at 9 o'clock p.o. So now that we've identified that and confirmed it, we're going to give our patient the medication now. The onset of diuresis when taking Lasix is usually within the hour. The peak is usually seen within 1 to 2 hours of taking it, and the duration of it usually lasts for about 6 to 8 hours. And some of the things you want to be considering and watching out for as a nurse is you always want to assess their fluid status periodically from that 6 to 8 hours. You also want to assess those lab values that I stated earlier, the magnesium, calcium, sodium, and potassium in the blood.